So
Hmm.
you get your providers to say, okay, I'll give it a try. I'll do one. They're enlightened to how great of an experience it could be. But then you have some health systems and hospitals who are trying to put virtual care in the market, and they're just getting very low uptake. They're not
Hmm.
getting the adoption that they would like. Do you have any advice for them on how they can help their market embrace it a bit more, or how they can promote it better, and what worked for Rush?
Yeah, I think uh, I think it's a bit of a journey, or it was. You know, one of the things that's amazing about the world of the COVID response is we've done things in days that would have taken us months and 6 months, 9 months at a time to do, to really respond to what was going on because it was such a dynamic environment. In the normal world, it was kind of a process, right, to really get this out there and really build it up. And for the asynchronous visits, we were on a path pre-COVID to do about 3,000 visits this year, but it wasn't turn it on and all of a sudden there's 3,000 visits. It was turn it on and get experience with it. And how can we learn from what we were doing on there? And how can we get feedback from patients very quickly about how we're doing this? We stood up doing NPS scoring with those patients after they did visits to get really immediate feedback from people as we were going through this. So it's a process. And I truly think, the consumer market is going to adopt tools that work for them, and they're not gonna adopt tools that don't, right?
Mm-hmm.
And working for them means easy access, means sort of multi-channel, means very timely, means different solutions for different points in time, kind of need. And there, it really requires having a focus of you're thinking about that consumer as opposed to a thinking that really doesn't have that consumer focus and just thinks patients will come to us the way they normally do.